Let me start with a statistic that should alarm you. According to the American Heart Association, nearly half of all American adults, approximately 122 million people, have high blood pressure. The truly shocking part? 75% of them are taking medication to control it. Yet, despite faithfully taking their pills, over 675,000 Americans die from hypertension-related complications every single year. I'm Dr. Eva Danial, and after more than 2 decades performing cardiac surgery, I can tell you exactly why these medications fail so consistently. Because what you've been told about high blood pressure is fundamentally incomplete, dangerously incomplete. You've been led to believe that hypertension is a plumbing issue. That's what your doctor probably told you. Too much fluid volume in your circulatory system, pressing against the vessel walls. Cut back on sodium, they say. Take a diuretic to remove excess water. The fluid volume decreases, your pressure readings drop, and everyone celebrates. Problem solved. Except it isn't solved at all. That entire framework represents outdated medical thinking from half a century ago. It's incomplete, deeply misleading, and it's keeping millions of people sick despite having seemingly controlled numbers on their monitors. The reality is infinitely more complex and far more important than anyone has explained to you. What high blood pressure really is. Hypertension isn't actually a plumbing problem about fluid volume at all. It's fundamentally about the pipes themselves. Your arteries aren't simply overfilled. They're damaged, deteriorating, rigid, and fragile. They've undergone profound structural changes at the cellular level that no prescription medication can repair. Let me tell you what I see when I perform bypass surgery and open someone's chest. A healthy artery has remarkable elasticity. When I make an incision, it springs back instantly, resilient and alive. But a diseased artery from someone with chronic hypertension? It feels like cutting into bone. It's stiff, calcified, rigid, almost lifeless. That rigidity, that fundamental loss of flexibility, is what hypertension actually represents. And here's the critical truth. Medications don't fix rigidity. They don't address the problem at all. They manipulate the pressure reading on your monitor in the short term, but they leave the underlying structural damage completely untreated, continuing to progress silently. By the end of this explanation, you'll understand the 4 hidden mechanisms that create hypertension and the complete 4-step protocol that can actually reverse this damage at the structural, cellular level. This isn't about managing symptoms. This is about genuine healing at the most fundamental level of biology. The 4 hidden mechanisms of hypertension. Mechanism 1. Glycolytic destruction and endothelial damage. Your arteries are extraordinarily complex living structures composed of 3 distinct layers working in perfect harmony. The innermost layer, the surface that directly contacts your flowing blood, is called the endothelium. It's a single layer of cells thinner than tissue paper that lines every blood vessel throughout your entire body. This layer is absolutely critical because it's far more than just a passive physical barrier. It's an active metabolic organ, constantly producing chemical signals that control blood flow, prevent inappropriate clotting, regulate inflammation, and maintain vessel health. But the endothelium itself has an even more critical protective coating, a microscopic layer called the glycolytics. Think of it like a non-stick coating on the interior surface of your arteries. This coating is constructed from sugar molecules and proteins only a few micrometers thick, completely invisible to the naked eye. Yet it's one of the most important structures in your entire cardiovascular system. Research published in Flugger's archive in 2007 established that the glycolytics performs several absolutely critical functions. First, it creates a smooth, frictionless surface, allowing blood to flow without resistance or friction. Second, it actively prevents inflammatory molecules from reaching and attaching to the vessel wall. Third, it senses changes in blood flow and signals the endothelium to release nitric oxide, a gas molecule that keeps vessels relaxed and properly dilated. When your glycolytics remains intact and healthy, your vessels stay flexible and fully functional. But when it becomes damaged and breaks down, which happens gradually, everything falls apart. Elevated blood sugar levels, chronic systemic inflammation, cigarette smoking, and oxidative stress systematically strip away the glycolics like acid, dissolving a protective coating. Once it's gone, your vessel wall becomes completely exposed and vulnerable to attack. Inflammatory molecules from your bloodstream attach to the endothelium. White blood cells adhere to the wall. LDL cholesterol particles penetrate into the vessel tissue. Atherosclerotic plaque begins forming. The endothelium stops producing adequate nitric oxide. Your vessels constrict and lose their flexibility. Blood pressure climbs. This is the first mechanism of hypertension, glycolics destruction, and endothelial damage. Here's the critical point that most physicians miss entirely. No blood pressure medication repairs the glycolics. Not ACE inhibitors, not beta blockers, not calcium channel blockers, not diuretics. None of them. They manage the pressure reading on your monitor temporarily, but the underlying damage remains completely untreated and continues to worsen. So your blood pressure numbers might look controlled on medication, but your vessels are still damaged, still vulnerable, still progressing silently toward a stroke or heart attack. This explains why people on blood pressure medication still experience cardiovascular events. The medication treats the symptom while ignoring the cause. Mechanism 2: arterial stiffness and calcification. Most physicians completely overlook this mechanism because it's not as simple as reading a blood pressure monitor. They focus exclusively on blood pressure numbers, but completely ignore whether arteries are stiff or flexible. And that distinction matters more than the numbers themselves, far more. Research published in the Journal of the American College of Cardiology in 2010 demonstrated through systematic review and meta-analysis that arterial stiffness actually predicts cardiovascular events and all-cause mortality better than traditional blood pressure measurements alone. Let that sink in. The structural quality of your arteries matters more than the numbers on your pressure monitor. Blood pressure is measured as two numbers, systolic over diastolic. The difference between them, called pulse pressure, gives valuable information about arterial stiffness. Normal pulse pressure falls between 40 and 50, but as arteries stiffen with aging and disease, something interesting happens. Systolic pressure increases while diastolic pressure actually decreases. You might end up with blood pressure of 162 over 72. The systolic is elevated, yes, but the diastolic is low and your pulse pressure is 90. This wide pulse pressure, anything over 65, indicates that your arteries are stiff and calcified, that your aorta has lost its elasticity and shock-absorbing capacity. A 2006 expert consensus document published in the European Heart Journal established that arterial stiffness can be measured directly using a test called pulse wave velocity. This measures how rapidly a pressure wave travels through your arterial system. In flexible, healthy arteries, the wave travels slowly, around 6 to 7 meters per second. In stiff, diseased arteries, the wave travels rapidly, 12 to 15 meters per second. The faster the wave velocity, the stiffer your arteries, and the higher your cardiovascular risk. This test is readily available and completely non-invasive, taking about 10 minutes to perform, but almost no physicians order it routinely. Why not? Because there's no prescription medication that fixes arterial stiffness directly. And if there's no pill to prescribe, most conventional medicine simply ignores it. Let me explain what causes arterial stiffness at the tissue level. Your artery wall consists of 3 distinct layers. The middle layer, called the tunica media, is composed of smooth muscle cells and elastic fibers. This middle layer gives your arteries their flexibility and their ability to expand and contract. But as you age, especially with hypertension, diabetes, or chronic inflammation, several destructive processes affect this middle layer simultaneously. First, calcium deposits begin forming. Calcium belongs in your skeletal system, not in arterial walls. But when vessels are chronically inflamed, calcium migrates from your bloodstream into the tunica media. It crystallizes and forms deposits, making the vessel wall progressively more rigid and inflexible. Second, elastic fibers gradually break down and degrade, only to be replaced by collagen, which is stiff and inflexible. Third, smooth muscle cells undergo a pathological transformation. They stop functioning like muscle cells and start behaving like bone-forming cells, actively depositing calcium and promoting calcification of the vessel wall. A comprehensive review published in the Journal of the American College of Cardiology in 2019 established that this process, called vascular calcification, is the primary driver of arterial stiffness and significantly increases cardiovascular risk. By the time someone reaches 65 with poorly controlled hypertension for years, their arteries can resemble bone tissue more than blood vessels. They're calcified, rigid, inflexible, and no blood pressure medication reverses this process. Mechanism 3. Nitric oxide deficiency. Nitric oxide is a gas molecule produced by your endothelial cells. Research published in the European Heart Journal in 2012 established that nitric oxide is one of the most important signaling molecules in your entire cardiovascular system. When nitric oxide is released from the endothelium, it diffuses into the smooth muscle layer of your vessel walls, signaling muscle cells to relax. Your vessels dilate, blood flows more easily, resistance drops, and blood pressure decreases naturally. Healthy, functional endothelium produces nitric oxide continuously, keeping vessels in a relaxed state and maintaining normal blood pressure. But when your endothelium becomes damaged, when the glycolix is stripped away, nitric oxide production drops dramatically. Your vessels can't relax properly. They remain constricted. Blood pressure rises and stays elevated. The enzyme responsible for producing nitric oxide is called endothelial nitric oxide synthase, or eNOS. This enzyme is damaged by the exact same factors that damage the glycolix: elevated blood sugar, oxidative stress, and chronic inflammation. But here's what's interesting. The eNOS enzyme requires several cofactors to function properly. The most critical is a molecule called tetrahydrobiopterin, or BH4. When BH4 levels are adequate, eNOS produces nitric oxide efficiently. When BH4 becomes depleted, eNOS becomes dysfunctional, producing harmful free radicals instead of beneficial nitric oxide. The enzyme is also activated by shear stress, the mechanical friction of blood flowing across the endothelial surface. When blood flow increases, the friction activates eNOS. This is one of the fundamental reasons why exercise lowers blood pressure. A 2014 meta-analysis published in Sports Medicine examined the role of isometric exercise training in reducing blood pressure and identified the potential mechanisms. The research found that isometric resistance training, which involves contracting muscles without movement, is particularly effective at activating eNOS and producing nitric oxide. Mechanism 4. The insulin-kidney connection. This final mechanism explains why reducing sodium intake doesn't work for most people with hypertension. Your kidneys control blood pressure by regulating sodium balance, but this entire system depends on your kidneys being able to respond appropriately to sodium intake. Here's the critical problem. Insulin blocks sodium excretion from the kidneys. When insulin levels are chronically elevated, your kidneys retain sodium regardless of how much you're consuming. You could eat almost no salt and your kidneys still hold on to it. Research published in the New England Journal of Medicine in 1987 established that insulin resistance is present in essential hypertension and plays a causal role in blood pressure elevation. Insulin acts on the kidneys through several pathways. First, it directly stimulates sodium reabsorption in the proximal tubule of the nephron. More reabsorption means less sodium excreted in urine and more retained in your bloodstream. Second, insulin activates your sympathetic nervous system, causing your kidneys to release renin, which triggers a hormonal cascade resulting in aldosterone release. Aldosterone instructs your kidneys to retain sodium and excrete potassium. Third, insulin increases the sensitivity of your blood vessels to angiotensin II, a powerful vasoconstrictor. A landmark 1991 paper published in Diabetes Care established that insulin resistance is a multifaceted syndrome responsible for hypertension, obesity, dyslipidemia, and atherosclerotic cardiovascular disease. This is why people with insulin resistance, prediabetes, or type 2 diabetes almost invariably develop hypertension. The elevated insulin is locking their kidneys in continuous retention mode. Here's what most people don't realize. You can have significant insulin resistance without having diabetes. Your fasting blood glucose might be completely normal. Your hemoglobin A1C might be perfectly normal, but your insulin levels could be substantially elevated, and that elevated insulin is driving your hypertension silently in the background. Most physicians never check insulin levels. They check glucose and A1C. If those are normal, they assume insulin is fine. They're absolutely wrong. The complete 4-step protocol to reverse hypertension. Now that you understand the mechanisms, here's the protocol that actually addresses them. Step 1. Restoring the glycolix. First, you must stop destroying it. The primary destroyers are elevated blood sugar and oxidative stress. Every time your blood sugar spikes above 145, it damages the glycolix through a process called glycation. Step 1 is stabilizing your blood sugar, not just avoiding diabetes, but keeping your post-meal blood sugar below 140 consistently. For most people, this means reducing refined carbohydrates significantly. I'm not suggesting eliminating all carbohydrates, but rather choosing carbohydrates that don't spike blood sugar dramatically. Whole foods, non-starchy vegetables, legumes, some fruits. Avoid sugar, white bread, white rice, pasta, and baked goods. Second, you must provide the building blocks your body needs to rebuild the glycolix. The glycolix is constructed primarily from molecules called glycosaminoglycans, long chains of sulfated sugar molecules. The best dietary sources are sulfated polysaccharides from seaweed, specifically fucoidan from brown seaweed. Research has shown these compounds restore glycolix thickness and improve endothelial function. Supplements containing fucoidan are available, and studies demonstrating benefit use doses of 600 to 1,000 milligrams daily. Third, you need to reduce oxidative stress significantly. The most potent antioxidants for vascular health are polyphenol from colorful vegetables and fruits, berries, dark leafy greens, beets, dark chocolate, green tea. These foods contain compounds that neutralize free radicals before they can damage your glycolix. Consider a real case, a 71-year-old with hypertension for 13 years, taking 2 medications. Blood pressure was controlled at 130/82, but lab tests showed elevated markers of endothelial dysfunction. I started him on this protocol, eliminated all refined carbohydrates, added fucoidan supplement at 800 milligrams daily, dramatically increased polyphenol-rich foods with a cup of mixed berries and 2 cups of leafy greens daily. After 12 weeks, endothelial function tests showed dilation improved from 5% to 13%. Blood pressure dropped from 130/82 to 116/74. He reduced 1 medication after 6 months and was off both medications entirely after 12 months. Blood pressure remained stable at 120/76. Step 2, decalcification, removing calcium from artery walls. Most people assume that once calcium deposits in arteries, it's permanent and irreversible. They're mistaken. The key is a protein called matrix GLA protein, or MGP. This protein functions like a traffic controller for calcium. When MGP is properly activated, it directs calcium into your bones where it belongs. When MGP is not activated, calcium migrates into your arteries and deposits in vessel walls. MGP is activated by vitamin K2, specifically the 7 Malawian Quatches form. Research published in Atherosclerosis in 2009 found that high dietary menaquinone intake is associated with reduced coronary calcification. The Rotterdam study published in the Journal of Nutrition in 2004 established that dietary intake of menaquinone is associated with reduced risk of coronary heart disease. Without adequate vitamin K2, MGP remains inactive and calcium deposits freely in your arteries. With adequate vitamin K2, MGP becomes activated, redirecting calcium out of your arteries and into your bones. This process can actually reverse arterial calcification. Studies showing benefit use doses of 180 to 360 micrograms daily of 7 Malawian Quatches. But vitamin K2 is only part of the solution. Calcium needs vitamin D to effectively enter bone tissue. Vitamin D increases calcium absorption from your digestive tract and helps incorporate calcium into the bone matrix. You need both working together. The third component is magnesium. Magnesium is nature's natural calcium channel blocker. When magnesium levels are adequate, it blocks calcium from entering smooth muscle cells in vessel walls inappropriately. When magnesium is deficient, calcium floods into smooth muscle cells, vessels constrict, and blood pressure rises. Magnesium also prevents calcium from crystallizing and forming deposits in vessel walls. Most people are deficient in magnesium because it's found primarily in dark leafy greens, nuts, seeds, and whole grains. Several factors actively deplete magnesium: chronic stress, alcohol consumption, diuretic medications, and proton pump inhibitors used for reflux. The solution is magnesium supplementation with highly absorbable forms like magnesium glycinate or magnesium threonate. These forms are efficiently absorbed, and the dose for cardiovascular health is 400 to 600 milligrams daily. Consider another case: a 74-year-old with hypertension for 18 years, taking 4 medications. Blood pressure was barely controlled at 136/86. A CT scan showed severe calcification throughout the aorta. I started him on the decalcification protocol. Vitamin K2 at 360 micrograms daily, vitamin D at 6,000 international units daily, magnesium glycinate at 600 milligrams daily. After 6 months, a CT scan showed calcification score decreased by 9%. Blood pressure dropped to 122/78, and he reduced from 4 medications to 3. After 1 year, calcium score decreased by 16%. After 18 months, he was on 1 medication with excellent control and sustained improvements. Step 3. Nitric oxide restoration. First, protect and boost BH4, the critical cofactor for the eNOS enzyme. Ensure adequate intake of folate, vitamin C, and vitamin E. These vitamins help regenerate BH4 and prevent eNOS uncoupling. Get folate from dark leafy greens, vitamin C from citrus fruits, berries and bell peppers, and vitamin E from nuts and seeds. Research published in the Journal of Cardiovascular Pharmacology in 1999 demonstrated that oral vitamin C reduces arterial stiffness in humans. Second, stimulate eNOS through shear stress. The most effective method is isometric hand grip training. Squeeze a hand grip device at 30% of maximum strength for 2 minutes. Rest 1 minute and repeat 4 times. Do this 4 times per week. This specific protocol has been demonstrated in multiple clinical studies to lower blood pressure by 8 to 12 points systolic after 8 weeks of consistent practice. Third, practice nasal breathing. When you breathe through your nose instead of your mouth, your nasal passages produce nitric oxide. Studies have demonstrated that nasal breathing increases blood nitric oxide levels by up to 400% compared to mouth breathing. This simple practice creates profound physiological changes. Step 4. The insulin reset. This final step unlocks your kidneys and allows them to excrete sodium appropriately. Elevated insulin locks your kidneys in sodium retention mode. You must lower insulin levels. The most effective method is time-restricted eating, condensing all your food intake into a specific window each day and fasting the remaining hours. For people with hypertension, I recommend a 16-hour fast with an 8-hour eating window. Consume all meals between noon and 8 p.m., fast from 8 p.m. until noon the next day. During the fasting window, drink water, black coffee, or plain tea. No calories. Research demonstrates that time-restricted eating lowers blood pressure by 9 to 11 points systolic within 8 weeks without any change in what you eat, just when you eat. The mechanism is purely insulin-related. Lower insulin means unlocked kidneys, which means appropriate sodium excretion, which means normalized blood pressure. You must also reduce insulin resistance at the cellular level. The most effective way to improve insulin sensitivity is resistance training. When you perform resistance exercises, your muscles develop more insulin receptors. Studies show that resistance training 2 to 3 times weekly lowers fasting insulin by 20 to 30% within 12 weeks. This is the foundation of genuine metabolic healing. The path forward. This is what genuinely reversing hypertension looks like. Not managing symptoms temporarily, not controlling numbers with pills that don't address the problem, but actually fixing the underlying mechanisms permanently. Glycolytic restoration, arterial decalcification, nitric oxide production, insulin normalization. These 4 steps address the actual root causes of hypertension. When you address root causes, blood pressure normalizes naturally because your body heals itself when you provide the right conditions. Start with 1 step. Pick the step that resonates most with you. If you eat refined carbohydrates and sugary foods, start with glycolytic restoration by stabilizing blood sugar. If you're overweight or have signs of insulin resistance, start with the insulin reset through time-restricted eating. If you rarely exercise, start with nitric oxide restoration through isometric training. I must be clear about something crucial. I'm not telling you to stop your blood pressure medication abruptly. That would be dangerous. Medication manages symptoms while these protocols fix root causes. You need both initially. Start implementing these protocols while continuing your current medication. As your blood pressure improves over weeks and months, work collaboratively with your physician to reduce medication gradually under medical supervision. Monitor your blood pressure daily at home. Track the trends. When your numbers consistently improve and remain stable, discuss medication reduction with your doctor. Never stop medication suddenly on your own. Never reduce doses without medical supervision. But also don't accept the conventional belief that you'll need medication for life. Conventional medicine doesn't know how to reverse vascular damage. They only know how to temporarily manage pressure readings. But you now know differently. The choice is yours. You understand the glycolytics, arterial calcification, nitric oxide, and the insulin-kidney connection. You understand the mechanisms. And when you understand mechanisms, you can correct them. This is what separates managing from reversing. Managing is pills for life. Reversing is structural repair at the cellular level. These 4 mechanisms create hypertension, and standard medical care doesn't address any of them effectively. Pills manipulate pressure temporarily without repairing underlying damage, but you can repair that damage yourself. Glycolytic restoration with blood sugar control, sulfated polysaccharides and antioxidants, decalcification with vitamin K2, vitamin D, and magnesium, nitric oxide restoration with shear, stress exercise, and nasal breathing, insulin reset with time-restricted eating and resistance training. When you reverse the mechanisms, blood pressure normalizes, not because you're artificially forcing it down with medication, but because you've repaired your vascular system at the fundamental level. You have this information now, information that most physicians don't have or don't think about. Information that could free you from medication and prevent you from becoming one of the 675,000 Americans who die from hypertension complications each year. Use it. Implement it. Start today. Hypertension isn't a permanent life sentence. It's a reversible condition if you're willing to understand the mechanisms and do the work to correct them. The choice is entirely yours. Choose reversal over management. Choose healing over dependence. Your vessels are the only ones you'll ever have. Take care of them the way they deserve to be cared for.